Diagnosing and treating scoliosis. Scoliosis is a highly prevalent structural spinal condition that involves the development of an unnatural sideways bending curve that also rotates, and the rotation is typically into the concavity of the scoliosis. Scoliosis is typically diagnosed through a combination of physical examinations and also X-ray results. A scoliotic curvature doesn't only bend, but it also rotates, which makes it a three-dimensional complex condition. A scoliotic curvature also has to be a minimum of 10 degrees to be considered a true scoliosis. And again, there must be rotation. There can't just be a bend because that's considered more of a postural shift. When we look at a Cobb angle, we know the Cobb angle is the gold standard in diagnosing and assessing scoliosis. And when we determine the size of the Cobb angle is typically done on a scoliosis X-ray by drawing lines from the topmost tilted vertebra to the bottommost tilted vertebra and expressing the angle in degrees. The higher the Cobb angle, the more severe the scoliosis is. Now, scoliosis, unfortunately, is a progressive condition, and in its very nature to worsen over time. And where scoliosis is at the time of diagnosis isn't nowhere indicative of where it would stay. In fact, it's more likely will worsen, we just don't know how fast or to what severity. Scoliosis ranges from mild to moderate to severe to very severe, and this is also the condition's progressive nature, and only proactive treatment can work in counteracting how progressive a scoliosis is. We know scoliosis is not a curable condition. It's uncurable, but it's highly treatable. There are never any treatment guarantees, but we particularly know that with early detection and early intervention, there's fewer limits that can be achieved and greater improvements can also be achieved. But most importantly, a lot of negative effects can be avoided, because when we look at scoliosis, we know as curves get bigger, they causes more problems, and typically traditional treatment approaches get more and more invasive. So we want to avoid negative effects by treating the scoliosis early. However, most traditional treatment options don't recommend those things. So when we look at scoliosis treatment approaches, we consider two options: traditional approaches, or what I like to call is modern conservative treatment. Traditional treatment options typically offer surgical responses to as curves worsen, while conservative treatment options typically offer non-surgical alternative treatments to try to stop scoliosis progression before it happens. And we look at spinal surgery as being a treatment option for scoliosis. We know spinal surgery is always a risky procedure. Spinal fusion is a lengthy, invasive, costly procedure, and it doesn't necessarily mean just in monetary terms. It is costly to function. Scoliosis surgery is something called spinal fusion, which is a non-functional approach, meaning it is fusing the spine from the most tilted vertebra on the top to the most tilted bottom in the below. Sometimes this fusion can span many vertebrae, 10, 12, 13 vertebrae, and it fuses the spine into one solid bone. And once these rods are attached to the spine, they use bone grafts to try to fuse the spine together, and it stops any movement in that area. And the spine is designed to be a functional to protect the spine and nerve system, but it's also designed to be a movement-based design for ours to have flexibility and ability to rotate and bend. Many patients are very disappointed with how much flexibility and range of motion they lose as a result of their spinal fusion. And we also know fused spines are weaker and more vulnerable to injury. So when somebody has spinal fusion for their scoliosis, it's not like they're leaving the surgery with more functions and more abilities. In fact, you're leaving the surgery with less functions and less ability, where conservative treatment is much less risky, much less invasive, and the idea, it's a functional approach to scoliosis. It's trying to reduce the curve while not removing normal, natural function of the spine. Normally, it will combine many types of treatments like chiropractic care, corrective bracing, physical therapy, rehabilitation, and home therapy and home exercises. And these things are normally combined in a certain way to reduce the scoliosis as much as possible. When we look at corrective treatment, we're trying to correct scoliosis, not correct what's causing it, but to correct the size of it and reduce the size and its magnitude to make the curve smaller. As we reduce the size of the curve, we're naturally improving the strength and function, because a straighter spine is more functional and stronger than a scoliosis that's more curved, and we're doing it in a non-invasive way. So we know scoliosis is diagnosed with a scoliosis X-ray, but more often traditional treatment options don't do anything until curves become severe enough to consider consider surgery. And then once you're considering surgery, you already have severe scoliosis, and the scoliosis surgery itself has a severe limitation to the person's body, health, and future. Where we know scoliosis is very complex, but if we treat it earlier when it's diagnosed and treat it when it's smaller, the chance of having significant improvement in avoiding the negative effects of scoliosis and having the negative effects of surgical treatment options can be completely avoided if curves are treated when they're smaller. So we recommend early diagnosis and early treatment. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.